Okay, so we're back. We're back here together, sitting here filming for today. We appreciate everyone who's been following along to my journey to just live thus far. We're gonna really dive into how I feel like crap and maybe the reasons why I feel horrible and how cancer treatment sometimes can hurt you more than the cancer. Um,
We can't hold hands the whole time, though. It's kind of corny.
I liked it for a second. Yeah. Basically, where we're at is I am not on treatment right now. We are paused on my clinical trial because things went south really quickly. And I am not the same person that I was 2 months ago, 3 months ago, 4 months ago. We're realizing since August 2025, I've been going downhill. And we have a media team here, and we were actually having a conversation before with them before we press record, and they can see it as well. They've been filming me for so long, and it's been an interesting,
Challenging for sure.
yeah. So a lot of you who are new around here, I think it's important to review that I was on a cancer treatment before, actually right at start of diagnosis. I was diagnosed in 2021 August with innumerable lung tumors, innumerable tumors in my liver, and cancer in my left leg. I have a tumor in my thigh and a tumor in my knee. There has been question if maybe the thigh tumor is not actually cancer, but hard to know. Can't biopsy. It's too deep into my muscle. And other doctors believe that is my primary site of my EHE sarcoma. So I went a few weeks not on treatment because I went 5 years begging doctors to figure out what was wrong with me. I had upper right abdominal pain every time I breathed. I was in so much pain, but I had a hemangioma that they always were kind of looking at. And the hemangioma was in fact my EHE cancer that we actually biopsied it. And it was only shown through ultrasound. When I got into CT, you could see so much more. So I went for the first 2 weeks not on treatment. 3 weeks, I think it was, just trying to see if I could go wait and watch is the protocol for 3 months, but I only lasted a few weeks because I got sick again and it showed my cancer had grown. So with that, I went on my first experimental treatment, and that is a drug called sirolimus, called Rapamune. And that drug was oral, and I got to take it from home where I belonged, and I felt like that was a gift. Because so many people with stage 4 cancer that I saw on social media was going to a cancer treatment center and sitting in a hospital type setting, hooked up to IV and sitting there for hours, losing your hair, looking sick, looking like cancer. And so I thought, what a gift that I get to take my meds from home. I can keep being mom and we'll see how it goes. We ended up having an early scan before the 3 months were up. Do you remember that? Because I had such bad pain, bone pain. It was my ribs were hurting so bad. And there was question about metastases to bone. And the first scan actually showed shrinkage, like huge shrinkage. I had tumors that had grown, I think maybe like 6 or 7 centimeters, I think, on my liver. And they went down to like 5 or something. And it was like, oh my gosh, like this is...
What's happening here? Yeah.
This is a miracle. Like, this is amazing. And there was no bone metastases at all. It was, we figured out a side effect from the drug caused bone, joint, muscle pain. And I didn't care anymore. I was like, I'll deal with this pain all day long if it's going to do these amazing things to my cancer. Our kids were only 5, 2, and 3 weeks old. And trying to be mom while navigating a new cancer treatment was really tough. But I found my way, and you reminded me about my mouth sores and how they kind of started at first. And how Hatton would kind of bump my mouth with his hand. He's only a little baby with flailing hands. And it would create huge sores on the inside of my lips, on my tongue, and it was really hard to eat and drink through those. But that treatment did really good, I think, at least for the first year. Every scan I had, I was either stable or a little bit of shrinkage. And then year 2 came around, and it was more just stable and it wasn't shrinkage anymore. I also developed an ovarian cyst, which I am prone to those because I have PCOS. And the ovarian cyst grew all the way at the worst to 7+ centimeters. Like it was a big guy. It was big. And I had pain from that. But during that treatment, I was like living my best life. I dove into
Yep.
fitness. I was training. I was running every day,
Mm-hmm.
pushing strollers, pulling strollers. I was doing it all. And looking at the treatment that I'm on now and trying to compare these two treatments, I would take that first one
Mm-hmm.
in a heartbeat over what
As it sits right now, for
as
sure.
it sits right now. So I ended up coming off of that treatment because there was no break in mouth sores anymore. It was constant my mouth, and
One
they
after
went
the
down
other,
to
yeah.
my esophagus, and eating and drinking became very challenging.
Mm-hmm.
The ovarian cyst got so large, and we were not wanting to operate on my ovaries because it is a vascular sarcoma cancer that there is this, do you call it a myth? Like
No.
it's a fact? Is
Yeah,
it?
I would say it's an anecdote that you would get from a bunch of different patients that have a feeling based on their own experience.
Mm-hmm.
Anecdotal evidence, I guess you would say.
Yeah, that if you create trauma to that area, that the cancer may in fact spread to that area or make your tumors that are there more alive, wake them up.
Yep.
And so we never wanted to operate on my ovaries to remove the cyst. And it was my doctor's decision to come off treatment. She was the one saying, no, no more. We can't watch you go through this anymore. I was also having progression, kind of scan after scan, small growth. And it was like, let's weigh this here. What's happening with your small growth? Would that happen if you were not on this drug at all
Right.
and stay the same amount of growth? Let's try it. And we were really nervous because how is it you're stage 4 cancer and not going to be on treatment? But that's what we did.
Yep.
So July 2024, I was no longer on treatment. And then I did my massive triathlon in August to celebrate my 3 years living with cancer. And I felt unstoppable. And then I continued to work out. 2025, to start January, was my journey to get jacked, not on cancer treatment. I was thriving. And every scan I'd have every 3 months would just kind of show small progression. And we watched the progression slowly pick up. And it was having consult with doctors that it was like, we need to have another cancer treatment lined up soon. The way this is going is not in the direction we want it to. We need to halt it and bring us back down again. But they didn't have options.
Yeah.
We learned about this clinical trial in January of 2025, the one that I'm on now. And they just didn't know when it would open. There was a lot of paperwork.
Regulations. Yeah, a lot of paperwork.
Yeah. And they just said, you got to be patient. And so every scan when I'd see my growth, I was being patient, being like, hey, there's a treatment coming. It's coming. It's coming. My miracle is coming. And I kind of put a lot of weight on this drug.
Mm-hmm.
So bring us to August 2025.
And like people that have tuned into or have like seen either of us speak about this before, not in detail like you're about to explain now, but I've always thought that your best treatment, it's hard to really conceptualize and put into words, and I don't want to sound like a broken record, what you were doing physically for yourself and how, I'm not going to say that, if you're diagnosed with like stage 4 glioblastoma, I'm not going to be like, just get on a treadmill. You'll be fine.
Yeah.
It doesn't work that way. But truly, the way that the human body is set up and the chassis has been the same for hundreds of thousands of years, right? And we're getting away from what we needed to do back then because everything is just at our fingertips now. We don't have to go out and forage for food. We don't have to go to the garden out in the backyard and grow our own food. We just walk to the store and get it, and in abundance, as much as we want. So we don't have to exercise to go and get what we need anymore. So you need to replace that somehow, and you need to replace it with exercise and moving your body. So I've always truly believed that even though it might not be your most therapeutic treatment, your your most effective treatment has been exercise,
Yeah.
in my opinion,
I
because
agree.
all of the most positive things that have come from this diagnosis and your outcomes with your body have come from exercise.
Yeah.
And like we were explaining this before with Jeremy and Steph, that there's like miracles are expensive. And I'm not talking about money. Like they're expensive for your body, they're expensive for your time, all of those things. And there's no free lunches. Like we can't just expect that you're going to take a pill and there's not going to be some sort of cost, right?
Mm-hmm.
Because it can help it go away for sure, but at what cost, right? Then that's what we've always needed to weigh.
Totally.
And that's what the cost benefit analysis is, why you came off the treatment before, right?
Yeah.
Why you came off sirolimus. And because it worked at the start, or seemed like it worked, or maybe that was just confounding, and like maybe it was the exercise. Maybe you were just coming down in inflammation because you were paying attention to what you should do with your body. And those anecdotal notes from other people are in fact true, that inflammation drives this disease. Maybe the disease is sitting in your body just waiting to feast on any inflammation it can find. And the key to that is to move away from inflammation, or the inflammation that's chronic.
That's what we have always believed, is that
100%.
my cancer has been, in my body, the cancer in me has been linked to inflammation.
Inflammatory.
And it's very inflammatory based, because when I would have my 5 years undetected where I was trying to get answers, it was always around inflammatory things that I felt my worst in my body. And we didn't realize it was cancer that whole time. So when I was diagnosed, my placenta had ruptured during my delivery with Hatton, and I had emergency C-section. And then my cancer went haywire. So I have been on naproxen, which is just, anybody can take naproxen, but I've been on a palliative dose where it's 500 milligrams 2 to 3 times a day to help take away my thigh pain and my upper right quadrant pain. And about a week into taking that med, I had no pain anymore, like no cancer pain. And I had dealt with pain for 5+ years. And I was like, this right here is a miracle drug, taking away my pain. And so I focused on creating an anti-inflammatory lifestyle. People always ask, like, why don't you just go full natural? I do so many natural things every day.
Yep.
I did my cold plunging, my sauna, a diet that supports anti-inflammatory practices, exercise, my multivitamins, always having an inflammation component within each individual vitamin that my oncology naturopath believes fits best for me. I've done all that. In 2025, I dove really strong into that when I was off treatment, really trying to capture an anti-inflammatory lifestyle. But my cancer is still growing. Small amount. It could have been growing more. I don't know. But it brought us to August 2025 when we got the phone call that my latest scan showed that my cancer had picked up in growth even more. And looking at from the very beginning to now, the rate of growth is concerning, and that we need to start something right away. So August 2025, they realized obviously I had to start treatment right away, and we got the phone call that the clinical trial was opening.
Yeah, the timing seemed amazing.
It was beautiful.
Yeah.
Like the timing was like, oh my goodness, because it was any day I had to start a treatment, and they presented 2 options. One was a drug called Votrient,
Panazepinib, I think.
Something like that.
Yep.
Panazepib, something.
Yep.
And that one can be quite harsh. And my pigment of my hair will change white. Like my eyebrows will be white, my hair will be white. But it was heavy on heart and body and organ.
Yep.
And I could do that treatment, which other EHE cancer patients were doing around the world and having success. And some people managed really well. Again, these are very individual, like side effects don't hit everybody, right? But then there was a clinical trial that's an immunotherapy clinical trial that sure has not been used on EHE before, but researchers are believing that there is a reason why that type of treatment is going to work on EHE patients. And we decided to go full on. I was willing to give my body up for research for myself, for my future, for my family, but also because somebody gave themselves up to go on that sirolimus drug
Right. That works.
that gave me stability at the start.
Yep.
They gave themselves over to research for that. So I felt like it was my turn to give back
Mhm.
to the cancer community and to try, because I needed something. My cancer's growing and it could be my miracle.
Right.
So I remember the day when my clinical trial nurse called and I cried on the phone because I knew any day I was having to start a treatment and I finally was going to be on one.
Yep.
And she said, sending over all the paperwork. And it was a lot of paperwork.
It was. Yeah.
And I said, I don't care what it says, I'm signing it.
Yeah.
It didn't matter to us. It didn't matter that it was in Toronto, that we'd have to travel. None of that mattered because we had a miracle in front of us, is what we believed.
Yep.
I did read the paperwork though, and that's when I saw that I needed to have tissue from a biopsy to be used for the clinical trial to test on, and I knew I had none left. My first biopsy in August 2021 landed me in the ICU from internal bleeding at the site where they grabbed the tissue from a liver tumor. And when the diagnosis came back, EHE, they wanted a second opinion. So Moncton, New Brunswick did a biopsy, Halifax, Nova Scotia did a biopsy, and then we did a third biopsy in Cleveland, Ohio. Dr. Rubin, who...
Well, I guess it's a pathology.
Biopsy. Sorry, not a biopsy, pathologies. And the third pathology was Dr. Rubin in Cleveland, Ohio, who studies EHE, and he is one of our lead researchers.
Mm-hmm.
And so we sent it all the way to him because it's such a rare diagnosis that we wanted to triple check, I guess.
Yep.
And I don't regret doing any of those things.
No.
But I had no tissue left. And I knew I didn't because my oncologist, the Princess Margaret, wanted to run some genetic testing over the years that I've been living with this diagnosis, and there wasn't any left when she tried to do one. So I had fear, genuine fear, going in for a biopsy because of how my first one went and how I was so ill from my internal bleeding. And they said, we need it. So it's like, what would you do? Would you let fear win and not do your clinical trial because you don't have a biopsy? I was like, not really a question. And I was at the soccer field watching, I think it was Hatton Soccer, when my doctor called and said, you need to go for a biopsy. We're going to make the arrangements. And I said, can I please have it there in Toronto? Because you see sarcomas, you know how to do this right. We live in a small island. We're in PEI, and they have not seen a lot of sarcomas and probably have never done a biopsy with somebody on EHE. We don't know of anybody else on the island that had this cancer. And this is a vascular cancer. This is a blood tumor. And there's risk, obviously, with any kind of biopsy from bleeding, and especially higher risk given a vascular sarcoma. And they said, I'm sorry, but if it's offered in your island, you have to do it there. So I did it. Went for my biopsy, and it was the worst day. That may have been the worst day of my entire life in terms of pain that I've ever experienced. And I believe I'm a pretty tough cookie. And I was crying and screaming and couldn't breathe.
Rough, yeah.
And it was horrible. I could feel the needle go through my capsule. I could feel everything. There was no sedation, and people ask why no sedation, but you do have to do some breathing strategies while they're doing the biopsy for them to get the correct angles. But they tried to numb, but my capsule, I felt everything around my liver, and it was very inflamed. And I left there uncomfortable and kept telling them I'm in so much pain. I was in recovery a lot longer than expected. You were freaking out when you saw me because I was not
good, no.
Not good. But I left that hospital that day. And we got to go home to our family, and I was home and I was recouping from home. The very next day I was scheduled for my CT again to check on how my cancer was doing. And we were actually filming with you guys, our media team, kind of recapping everything that took place and getting ready to leave for Toronto soon and start this next journey. And I got a phone call while we were filming that they found in the CT, there was a perforation from the biopsy, and there was air where it's not supposed to be. And I needed to go in right away and potentially surgery to repair the perforation. They thought bowel perforation at the start. So when I arrived at the QEA to the hospital that we go to, I was met with so many nurses and doctors, rushed to a trauma room, hooked up to everything. And I just kept looking at them like, I'm fine.
Yeah.
Like I wasn't really in any pain.
No.
I had maybe minor pain from the biopsy.
Yep.
But I was not the same when I landed in the ICU after the first biopsy. Like that was not the same comparison. And so meeting with everybody, I just kept saying like, I think we're like overreacting here. Like I feel like I'm fine.
Yep.
And they said like, no, like this could be this, 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 and this. So I was just kind of monitored in the trauma room. And my vitals kept being great. Blood work was coming back great. Everything was coming back great. And they ended up discharging me.
Yep.
And said, we're just going to monitor this from home. And I think it was 2 days later, we landed back in the ER. I ended up getting the pain that they had talked about.
Yeah.
And I went back and we did a CT and it showed the perforation was still there, but getting better.
Yeah.
And that my body's just going to reabsorb the air.
Yeah.
And you should be okay.
Yeah.
I guess. And then the most devastating phone call came in. The biopsy didn't work.
Mm-hmm.
And they did not get enough. There was no cancer cells pulled from the biopsy. And it was like, is there no cancer cells pulled from the biopsy because there's no cancer in that tumor and I'm like cured?
Yeah.
Or what happened? And it was the latter part, that they just didn't pull it properly. And they wanted to do another biopsy. And we were like, we hemmed and hawed on that one. We hemmed and hawed, being like, how am I going to go through that again? And that's when I called Toronto and said, I'm not doing
here.
I'm not doing it here. So the second biopsy was done in Toronto. We left the kids. We went over, and that was like amazing.
Yeah, night and day.
You were waiting for me to come out.
Mm-hmm.
And I think I danced out of there. We did a vlog, and I like walked and danced out of that biopsy being like, that was no big deal.
Yeah.
And minor pain. I did so well. And the doctor was quite confident that he pulled cancerous cells. And we just had to wait to confirm the cancer before I could start treatment. And it was 1 week later, we had to fly back to Toronto. And I was presented this immunotherapy drug. 4 pills taken in the morning, 4 pills taken at night. And that was my miracle, I believed.
Mm-hmm.
And it still could be my miracle.
Yep.
So with a clinical trial, it's been very hard for me to share openly about how it's going. And I have had 1 scan. I've had 3 scans, actually, since being on this treatment. And I can't share the results of what the scan shows. But I can kind of run you through some feelings that I've had in my body since biopsy to now. Because the biopsies, I think, is when I started to decline.
Mm-hmm.
I think my decline started then.
Yep. Yeah, that timing makes sense.
It does.
Mm-hmm.
I was so active before biopsy.
Yeah.
I was living my best life.
Moving and shaking.
We were
for sure.
We were running PRs. I was getting definition in my physical body. Like that creatine was like making me like, rah!
Well, yes, the creatine's not going to do anything.
No, but I was
in
working.
And itself. You were putting in the work too.
But but I was always putting in work. But then when I started taking creatine, it was like, wow, look at the body definition now. Like I was seeing it for the first time.
For sure.
And I was believing it, that like this body is strong.
Yep.
And yes, I was putting the work in 5, 6, 7 days a week. I was doing it. And then August hit. So we just made this connection now. It's January 2026. And we really sat there and thought, when did all of this start to go wrong? Mm-hmm. And it leads back to that first biopsy.
Well, when the needle went in too, you said you kind of jumped.
Oh, I jumped. I jumped instantly. I felt it. And I moved my body and I screamed. And he was like, you felt that? Mm-hmm. And I was like, yes, like get that out of me. Like it was awful.
Yeah. I
caused whatever issue happened. I caused it by moving my body. I know it. And I remember it. Mm-hmm. I believe it comes down to that.
So do you feel that feeling, the pain, is it where your discomfort is today?
they were pulling a tumor that was one of those that were on the upper part to the inside.
Mm-hmm.
That's why I want these doctors to have full picture.
It's hard too to get full picture too, because I mean, there's so many cooks in the kitchen. Like there's so many doctors involved, so many hospitals involved, so many specialists involved. And it's hard in the Canadian healthcare system too, because it's not like McDonald's. You can't say like, I'll have a number 6, 2, 3, and 4. It's like, you can have a number 6 in 3 months. So go get in line and it's like the ultimate, can you pull up and we'll be out with your food? It's like the ultimate that thing. You know, when you get like something that's like a specific, like I love the fillet of fish. If you're ordering a fillet of fish, it's not coming out the window. You're going to have to park up there. It's just the way it works, right?
Yeah.
So you're a fillet of fish.
I'm a fillet of fish.
You're a fillet of fish. Or a double fillet. Oh my God, double fillets are unreal. They have the perfect bun. Okay, let's get back to the podcast. Sorry.
You were so
Fillet of fish are awesome.
We love
Sure
McDonald's.
is. Any fillet of fish lovers out there?
We do. And did you guys know, fun fact, McDonald's is our sponsor for our 5K Just Live Fun Run.
That's right. Yeah, maybe
Love
fillets for everyone at the finish line.
I'll talk to them about
It's the bun. It's like, glazed over. Okay, one more quick one. Whenever I was a kid, when we go through the drive-thru, my dad loves fillet of fish also. He would get to the window and he'd say, "Are there any fillets up?"
He'd ask ahead of time.
Like at the intercom, asking if there's any fillets of fish that are up. It's like, bro, there's never any fillets of fish up.
And then would they say,
you're gonna have to order it. You know what I mean?
Did they ever say yes?
Not that I remember.
Oh,
Not that I remember. Anyway, yeah.
Okay.
You're a fillet of fish. Continue.
I'm a fillet of fish. So
it's hard. It's hard to, because there's so many people involved, that it's hard to just be like, get them to connect the dots. You know what I mean?
Totally.
And get the full picture.
Yeah. So if you're just tuning in now and wondering kind of what is going on with me, I have developed GI related issues of what we've been battling with for the last 2.5 months, almost 3 months now.
And it's been tough to pin down when those began.
Yeah. So when we really sat down the other night in the sauna, I explained to you that I remember going in after 1 week of being on trial and reporting that I had nausea, early fullness. You would try to feed me. I'd eat maybe 5 bites and be like, I'm done. I can't eat anymore.
Mm-hmm. And
just a feeling of being full and not hungry.
Yeah.
I guess, more or less. Pressure. Yeah. But not severe where it was like, I'm uncomfortable.
Right.
And the pills are quite large that I always felt that they didn't really like sit properly. And I would wake up in the morning being like, oh, I can still feel them kind of thing. That was from the very beginning. And now I think it's because of my biopsies, not because of the trial.
Mm-hmm.
So every week you go in, every week we had to fly to Toronto, every single week for the first 4 weeks and report my symptoms, do my blood work, and my blood markers changed. I'm on a new treatment now. Of course, things are going to change.
Yeah.
And there was one particular blood marker that I brought to their attention that we had never talked about in any of our meetings with the clinical trial team in November time, when my stomach started to create what we thought was gastritis. I have had clinical gastritis before, where I had an endoscopy and it was confirmed I had gastritis. And it was from my chronic use of naproxen, which is a palliative dosage that I'm on because I'm a palliative cancer patient. My cancer is incurable. And our goal is to focus on my quality of life as opposed to my quantity of life, because I have so many tumors throughout my body. I could live to 97. I could be a palliative patient to 97. Like, my cancer could slowly grow forever. Or the very next breath, it could pick up and I could be gone in a couple weeks.
Or it could stay stable, or it could shrink.
Exactly. Yeah. We've seen it, unfortunately. We've seen it many times with EHG. And that's the hard and kind of a scary part of it. So when every week I'd be going in there, I was kind of reporting the same things. I ended up doing high rocks in October.
Yep.
We flew up with our media team. We did that. And I wasn't feeling my best self because I wasn't training properly, because of my 2 biopsies back to back, navigating this new treatment. And that race was different. I
Yep.
still
Made it through.
did it great.
Yep.
You know, we think we came in the top, I don't know what percent was. We did really well, but it wasn't what I used to be like.
Right.
And then when the GI issues picked up, when I mentioned the gastritis, it was November 4th. It was my birthday. The four of us went out for lunch.
Yep.
And I thought it was my wave of nausea hitting me. And I felt ill and I couldn't even eat my birthday lunch. And it was from that moment on that the stomach pain started to get worse. It was like burning, felt like gastritis is what I kind of thought. I was flying to Toronto for my clinical trial, sat down with the team, reported all of my symptoms, and they too believed gastritis. And they thought, you know, we should order an endoscopy just to confirm this diagnosis. And I was almost going to cancel it because I thought, like, why put my body through that when I know this is what it is and I know how to repair it? I was taking my sucralfate, I was taking these drugs that they had recommended, but I just wasn't feeling well. It wasn't going away. And doing all the things that I had done before, it wasn't working this time.
Right.
So I go in for my endoscopy and the doctor found a pill sitting in my stomach. And that is when they looked at us and said, we believe the biopsies will come back, not gastritis. I didn't see any major inflammation in there, but that the pill sitting in there is a potential for slow gastric emptying, and that you need to meet with GI and discuss next steps. And so they put me on motility drugs that day.
Yep.
And I started taking those. And then within like 4 or 5 days after that, I started having slow bowel motility. My bowels were not going anymore. And I don't even know how we led to my decline. Like, it just kept getting worse, I guess.
Yeah, it just kept getting worse.
And I found eating food was creating pain that then started to radiate to my back. So the pain that started in the front where your stomach is, I was navigating that for weeks, then radiated to my back. And it was the piece of pizza.
Santa Claus Parade.
Santa Claus Parade, when things really changed. We went to Santa Claus Parade. Right after the pizza spot, shout out to Greco. Delicious. Had a slice and maybe a garlic finger. And that set me over the edge. I was in excruciating pain through my back and I couldn't breathe. I couldn't move. And we ended up going to the ER. It was our daughter's birthday and I did not want to go, but I knew I had to go because I was in so much pain. We got her off to school and I said, we'll just go and I'll be back home by the time. Yeah, my nose was running again. I'll come back. And that's what we ended up doing. Went there, and that's when they introduced me to Maxarin, metoclopramide. It is a slow motility medication. Also helps with nausea. And they gave me that on IV. And I said, whatever is in this bag, I want it. I want it forever, because it took away my pain for the first time in almost a month. It was like, it was a miracle. Like, I looked at that doctor and said, I need this, whatever this is. They said, that's the same drug that you're taking orally that they had prescribed you from your endoscope. But maybe because of your slow motility, the pill's not doing what it's supposed to do. So my palliative care team had offered to do sub-Q in my arm, teach you how to do it, and maybe bypassing the stomach, the drug might be able to give the same effect as the IV did at the hospital. So they said, go back on, your slow diet. At this point, I was only eating mushy food, soups, really boring diet. And you started giving my sub-Q at first it was every 4 hours. And it was day 3 of being on this drug. I developed my first panic attack I'd ever had in my life. And my heart goes out to those who have anxiety, who have had panic episodes, because it was the scariest moment. And I was alone with the kids. And it was all of a sudden like I felt this wave in my body. And it was like my skin was crawling. I needed to jump out of my own skin. I couldn't calm down. I was like shaking, vibrating, and I didn't know what was happening to me. And I actually have to have a huge shout out to my community because I went on my stories and said like, oh, this drug's making me all kind of crazy right now. I'm going around and I'm vibrating. I don't know what's happening. And it was so many of you wrote me, said, if you're on Maxarin, that is a negative side effect. You need to call your pharmacist right away.
Mm-hmm.
And so huge thank you to you because I just thought just had to suck it up. I thought that was just normal. And I didn't realize what it was actually happening in my body.
Mm.
And we called our pharmacist. And that's when they had said, you need to take Benadryl. And by the time I think I was coming down off of it anyways, by the time we got a hold of it.
This is the point where I was starting to get annoyed with what was going on. Because this was like 2, 3, maybe 4 medications. And then it's like, oh, just take Benadryl. That'll make that go away. So it's like you're putting Band-Aids on top of Band-Aids on top of Band-Aids. And it's like, no.
Yeah.
What's going on here? Like, there's something else going on. And also, I know that like I can't speak to like a chronic illness or anything else of any other family members, but when you have to start putting things on top of things to mitigate symptoms, it's like I don't know, man.
It didn't sit well with us.
Yeah.
So we ended up going, back into palliative care, and we had said, this is a drug that works for me. This is the only drug that takes away
You have to think about Maxarin too, is that all of the rest of these, actually I can't say for certain all of the rest of them, but the Maxarin was, to my knowledge, as I'm explaining right now, the only one that passes the blood-brain barrier. And that's a big distinction because what the effect is on the body, there's also an effect on your brain, which that effect can be long lasting, but the other ones are just affecting your motility mechanically and like the chemicals that are locally happening at those sites. But the Maxarin, it has those effects mechanically and also chemically around your organs that it's trying to help, right? But it also gets into your brain tissue.
Yeah.
So that's important to understand.
Totally.
Right?
So when we met with palliative, I had said like, I want this drug to work because it was the only thing that took my pain away. And I kept having these massive pain flares, even with only having sips of boost. Like I was having...
Those pain attacks were pretty bad too.
So bad.
Pretty bad.
And I was losing so much weight so quickly. In the end, it was 18 pounds that I had lost. I'd hold my leg up and I couldn't even recognize my leg. Like it would, where my shin bone is, it would be concaved and then it would just be sagging skin.
Mm-hmm.
And I wasn't recognizing this body anymore. And it was getting so worried of how much weight I was dropping that we talked about having like feeding tube at one point. And it was like, this is like, what is happening?
Yeah. And like, even if we can't share what's going on with the trial and results, it's like positive or negative outcomes at all.
Yeah.
Either it's like,
my body is declining.
Why?
Yeah. It was not, it was bad.
Yeah. And that's a consideration that all oncological teams have to have discussions with patients, which we have.
Mm-hmm.
It's like the benefits of your lifespan or how well you're living, they have to be in balance with the health span that you're experiencing at the moment, right?
Yeah.
Anyway.
So we ended up talking with pharmacy, palliative care, and it was decided we would continue on the Maxarin, but half dosing it and doing it every 2 hours to see if maybe I wouldn't have those crazy side effects anymore. Mm-hmm. And it was going well for so many days.
Mm-hmm.
And we finally got a referral to a GI doctor in Toronto. So we just kept saying, we'll do this until we get there, finally meet with GI, present everything, share all the drugs that people have been putting me on, and ask,
what do you think?
What do we do?
Yeah.
What do we do? And it was flying to that Toronto appointment. We were on our way to the airport. I remember vlogging, and I looked at you and I could feel it. I could feel the side effects coming, and we were doing it every 2 hours. And I was like, this isn't good. I can feel the panic. Like it's starting to overwhelm me. Like I'm feeling overwhelmed. How am I going to get on this airplane? And you looked at me and you were like, don't eat a single thing. Don't drink anything. Let's just hold the meds.
I'm not doing this anymore.
And we're not doing it. We're not doing it anymore. And I was like, okay, I knew I just had to get to Toronto is all I really cared about. So I stopped eating, dealt with just like chronic pain that I felt, which I feel through the middle of my back and the front of my stomach. And we get to Toronto. The next morning we wake up and we meet with this GI doctor. And we told her what I was feeling on this drug and said, like, I almost feel like an addict. Like I needed that drug. I was sitting there and I was bouncy in the waiting room still. Like you just kept resting your hand on my leg, like, stop, stop. And I didn't even know I was doing this. I was just constantly like this, like constant.
Yeah.
And I meet with the GI doc and she's like, I hate that drug. She's like,
Well, before that, at the start, it was like, okay, well, we'll continue on with the Maxerin and we'll add this other drug, like a different one. And I want to have like a disclaimer or a caveat even to begin this, that the second drug, which you're on now,
Yep.
was an antidepressant.
Mm-hmm.
But an antidepressant at certain levels, right? Like at certain dosages, which you're not on. There's two different functions for these dosages. One, the higher dosage is for antidepressant, and the doses that you're currently on is for GI stuff, right?
Mm-hmm.
It's like a brain connection
To relax.
to the gut,
It's
right?
to relax your stomach.
But we had Maxerin that was giving you these negative symptoms, and that it was like, we're staying on that. And there was a couple of other ones that they were just tossing at it to see if like it would put out the flames.
Mm-hmm.
And now we're adding this antidepressant, and I was like, hold on, like is this like? And again, full disclosure, I have no issues whatsoever for antidepressive medication. I think they're essential and life-saving for people. But I was like, is this an SSRI? Like, is my wife going on SSRIs because of a gut issue? Is she still gonna have these experiences with Maxerin? I was like, no, we're like we can't do this. Like, we can't keep throwing drugs. And it's not. I don't even think there was no fault to any of the doctors, because, like I said, there's so many doctors involved that she's not. Even if it's on like a consult chart or some like your file,
Mm-hmm.
it's like she's only a human being, so maybe she can't see all of them, or maybe she does see them all, and like she can't really see for sure whether or not you're on all of these different drugs. You can't really conceptualize it unless you have one personal doctor that knows you specifically, that can tell, well, I know you're on this, and this, so let's consider this for a second. You know what I mean? It's like, the difference between for all of its faults, the American system would be different. Like, if you're loaded rich, that would be great. Because yesterday, I think it was Hatton, or maybe it was Juliet, asked like, oh, does Taylor Swift have her own doctor? And I'm like, I'm sure she does. Like, I'm sure she does have her own doctor that comes on tour with her. And like, if she's sick or needs anything whatsoever, they're at the ready right now. You know what I mean? So it's like, that's a stark contrast to what we have, where it's like some things don't get lost on purpose, but they're only human beings that see so many different patients. And like Dr. Razik was explaining that as well the last time we had a chat with him. It's like, we have 30 patients that we have to see, and we only see 12 of them because we don't have the time. Whereas like an American doctor, you can pay as you go, and they'll know everything about you. And like,
I think it's unfair to compare Canadian and American.
And there is no comparison.
I don't typically get involved with that. I did it on my platform the other night, and I regret doing it because of the conflict and feuds that it creates.
It can, yeah. It's a personal issue, right? Because health is personal.
It is,
Yep.
yeah. So it's hard. But I do agree with a lot with what you're saying. But I thank you for being such a strong advocate in those meetings, because I'm so fuzzy that all I want is like an addict needs a hit of this drug that I know as soon as I take it, it takes it away. And this doctor explained to us that you are one dose away for permanently feeling those negative side effects. And
Correct.
It may never happen, or it could happen in your next dose, and you could be like this forever. I also was having heart rate fluctuations really bad on that drug. My heart baseline is very low anyways. I'm usually like a 52, 55 beats per minute kind of girl. They call it an athlete's heart. I haven't been an athlete in months. It was dipping to 38. and going up to 150s. And so I'm very grateful for my Whoop that tracks all of that to show them. And I had to have an ECG right away. And it did show, I think I was at like a 51 or something, and it was lower than normal. And it was coming down to this drug causing a lot of these really negative things to my body. And when she said that to us, you were like, you're done. You cut me off.
It's this big cloud, right? It's like we have this cloud that's over us right now, and we're dealing with all those things. And then off to the side, I have fitness, nutrition, sleep, relationships, and mental health. That's just over in the corner being like, we'll be here when you're ready. You know what I mean? And I'm not saying that that's the magic bullet for everything, but it's like it's sitting
do any of those things because I
totally agree with you. And
I can barely breathe.
I totally agree with you. And like it's the cloud, it just seems so big looking to the past. And then I'm always looking to the future to be like, when can we get this over with so we can get back to what we're supposed to be doing, which made you so vibrant, right?
Yeah.
But then I think to myself, we can't get back to that. Not yet anyway. And like, I think that's what makes it not difficult, but it also gives me insight that, and the part of our faith comes into this as well, where you want to take away your pain, and we know Maxerin takes away your pain, but we can't do that. We can't take Maxerin because it's so detrimental to your current health and also to your possible future health forever.
Yeah.
So when you're in pain, I have to watch you be in pain when you drink water sometimes. And you ask like, when is this going to end? And how long is this going to go on? And the only answer I can give you is a little while longer. You'll have to wait a little while longer. You'll just have to wait a little while longer. And there's nothing you can do about it. It's a situation where you essentially have to voluntarily pick up your cross and walk uphill for as long as you possibly can.
Yeah.
Because you're just going to have to wait a little longer. And that sucks.
It does. So we left that appointment with GI with a plan to say goodbye to Maxerin. I don't want to scare anybody with Maxerin, but I also want to educate you about Maxerin because somebody educated me. A lot of people in the States, I think you call it Reglan, Reglan, is another name for it. And some people taking it, when I was taking it by pill, I was on it for almost 3 weeks by just pill. I was not having any of these side effects. It was when I switched to the sub-Q is when things changed.
And this is not for everyone.
And again, every drug affects everyone differently, and just educate yourself is all I can say. Just
I'm sure people are on it for years.
Yeah.
And with no issue.
No issue. So just knowledge is power is all I want to say with that. And we'll end the Maxerin chat with that. I would take a hit right now if I could because it would take everything away. But we then decided to go on domperidone, which, yes, some may hear that drug and think of lactation. I used to be on that when I was nursing one of our kids when my milk supply was low. But again, it also relaxes the gut and creates support for GI-related issues.
Yep.
So I started going on that compounded. So we decided to stop with pills and start compounding all these drugs because of the slow gut motility. The GI doctor wanted a gastric emptying test done. She said, we're going to treat it like it's a gastric emptying issue, that your stomach is not relaxing enough and it's holding on to food too long. But you need to have a test done to see the percentage of how long it takes to pass through your body. And that's a test that needs to be ordered. She also questioned, with that blood marker that I brought up to my team, that I've been watching myself, and that my medical AI app that I've been using, where I report my symptoms every single day, picked up and thought this is something to watch.
Disclaimer, that's not a medical doctor either, so don't count on that either.
And I know that. And I'm using it as a sounding board.
Yes.
And I trust my team. And the GI doc said, that is an interesting, I was going to mention that. I would like to have rheumatology and hematology involved and looking at potential autoimmune issues I could have developed because of clinical trial, or I was already underlying issues just kind of came out because I'm on new medications and all these different things. But fun fact, our island does not have those two specialists, and we'd have to fly back and forth to Toronto on our own dime to meet with those specialties. She also noted a condition called dyspepsia.
Dyspepsia.
Dyspepsia. D-Y-S-P.
Dis, like I'm dissing you. Pepsi, the drink.
Okay. Okay.
Dyspepsia.
Dyspepsia.
Good try.
Try it again.
Dyspepsia.
Dyspepsia.
Nice.
I did it.
Crushed it.
Okay. So that is the other condition, functional dyspepsia.
Nice.
That was good.
Yeah.
If that is what my GI issues are, which is my understanding, nerve, muscle, out of sync, not working properly, and to the brain issue. Mm-hmm. Fun fact, if you're new around here, just had the gastric emptying test and it came back normal.
You're normal.
I'm normal. That was not it. So now the question goes back to dyspepsia. Dyspepsia.
Dyspepsia.
Why can't I say it?
Just do dyspepsia.
Dyspepsia.
Dyspepsia. Nice. There you go.
Dyspepsia.
Dyspepsia.
So now it's coming back to dyspepsia.
It's just okay, but that's all right.
Whatever.
But the problem with the dyspepsia now is that it still doesn't tell you why.
It doesn't tell us.
It's just like, oh, you have dyspepsia. Yeah, got it. Why? You know what I mean?
Yeah.
It's like, oh, your muscles and your brain and your nerves aren't connecting. Yeah, got it.
I know that.
Yeah, we know.
One of the tests we also had to do, I should back up, was I had to do a gallbladder, pancreatic, bile duct ultrasound.
Mm-hmm.
All of my blood markers, I've been doing so much blood work. Every week I'm there, every 2 weeks, it's been a lot of blood work. All of those came back normal. I have had 3 CTs because of these issues that I was having back and forth to the ER, looking at all of that. I had 2 ultrasounds actually, and CTs. Everything is showing gallbladder, pancreas, every other organ looks normal. When I got my GI gastric emptying test back and it said normal, I then started to look at what my AI app has been suggesting, which is actually a gallbladder function test. That maybe your gallbladder presents normal on all of these scans and blood markers, but the function of it,
the mechanical
moving things along, is not working properly. And it's a test called a HIDA scan. Mm-hmm. So many of you in our community mentioned it as well. And so when I talked to the doctors and everything came back normal, I asked, can you consider this? And my doctor, who's local here, is not a specialist. She's not a GI doctor. She's in the cancer center here. Said that she can't order that test. Mm-hmm. I found out the moment I got my results that my gastric emptying test was normal, that the HIDA test is only scheduled every 3 months on our island. Because it's such an expensive test, I tried to group everyone together. And there was 1 slot left, and it was happening this week. So the following few days. And I was like, this is my nudge. This is me moving forward in faith, being like, all of these are lining up. Like, the fact that it's happening next week,
that's
like,
your spot.
This is my spot. Like, this is for me. So I begged to GI for them to consider it and wondered if they thought that it was something that I would need. Again, my AI brought me here. I trust my team and their knowledge. Is this what I actually need? Mm-hmm. And they said no. They said, no, we're not running any more tests. We think gallbladder is functioning fine. And we're going to focus on medication management now. Now that we know it's not slow gut motility, you can come off of your domperidone. And we're going to focus on increasing this new antidepressant drug, mirazapine, that relaxes your stomach more helps with spasms, helps with all these different things. And we're going to increase that dose. And it just didn't sit well with me. It kind of crushed me. Because why can't we just do that one test and then we just know it's not that? Because what if it is? So many in our community have reached out that they have had normal labs, normal CTs, normal ultrasounds, and then they did this test and it showed their gallbladder wasn't working and their pain was gone. Removed their gallbladder, which I know is a big deal. My mom had hers out. My sister had hers out. You just take that out and they're back to living their life like this. So I haven't been able to talk to my GI doctor. I'm only going through my clinical trial team and my PEI doctor who's talking to them. And I want to talk to the GI doctor. That's where we're at now. I've increased the medicine that they wanted me to, which comes with other side effects. That particular drug makes you very tired. I take it at night, but I don't wake up. You have to wake me up. And you have to wake me up again and again and again. And I could be sitting here on the couch and all of a sudden I'm asleep again.
Yep.
It makes me very fatigued. With going up in dose, that's the concern again. But so far it's not been horrible.
Yep.
But my GI issues are still there. They're getting better. Yes, because I'm eating solid food now, but they're still there.
Yeah.
So I stopped my clinical trial med December 22nd, right before Christmas.
Yep. Pause.
As a trial and error to see if was this immunotherapy that created all of these issues. And I started a heavy high-dose steroid, prednisone, 70 milligrams. And I never felt the effects of the steroid for the first 2 weeks. They kept saying, you're going to feel like a superwoman. You're going to feel like a super mom. And I've been waiting and still waiting to feel like a super mom. And I never felt it. So I'm now weaning my steroid and I have to continue to wean for the next 5 weeks until it gets down to 0. And then we decide when it gets down to 0 what the next steps are. How's my GI? Am I fixed? Am I not? So we have basically 5-week waiting period to get me back to normal. And then when I get to normal, do I go back on the clinical trial drug that may or may not have caused this? Or do I
keep pausing for a while?
keep pausing?
Or who knows what?
So I'm allowed to pause, they said. But we don't know how long I'm allowed to pause before I'm kicked out of trial. So
Kicked out's aggressive.
they're kicking me out. It's a kick out.
I don't think they're going to kick you out.
They would kick you out.
Well, I guess it's appropriate then.
What would you call it?
Kicked out seems like you're like getting kicked out of Myron's, like the back door. Like,
Myron's is
get out of here.
Myron's is our local bar we used to have here, where we fell in love.
Yes.
Um,
Evacuated? Ejected. Ejected's pretty aggressive too. That's like out of a plane going down.
You're kicked out. You're done. We don't want you a part of this anymore. You're not
You're
taking
no longer a part of the trial.
You're no longer in it. You're done.
Yeah.
So these next 5 weeks are going to be big. But
Or small.
Or small.
Hopefully small.
I think this trial was a lot on me, on you, on our family.
Yeah, for sure.
It also has cost us a lot of money.
Correct.
We have to pay for it ourselves. Our island does not cover it. The island will cover my blood work, my CT scan, my hospital visits, but there's no coverage for accommodations, for food, travel expenses. And the only way we're surviving is because there was a GoFundMe at the start of my diagnosis when we had to move from our home in Northwest Territories to relocate to PEI. And a certain amount of money was raised. It wasn't a lot of money, but it just happened to be just enough to cover these travel costs. So we haven't had to touch our personal money yet. We're very lucky and we're very thankful. So thank you to those who donated 4 years ago. You really made a massive difference. The money's really down there. And this is a 2-year trial. But my travel time slows down. You only have to
Yep.
go there once a month now.
Yeah, which is great.
So we knew
So it'll be
we
okay.
would be okay.
Yep.
So many had said, like, start a new GoFundMe and please donate to others that need it. Your heart is there, but we're okay.
Yeah, so you also did a heart-to-heart about that too, if
I
you
did.
want to reference
Yeah,
that.
there's another video out there about that. But where we're at now is I'm in pain no matter if I eat or don't eat. I've been specific foods where I've cut out things, done celiac testing. People are mentioning SIBO as something to look into, SIBO. One of our children's actually doing the SIBO test because they have some GI issues. So maybe I will do it. That's like a $400 test and it's a lot of work to get done. So I might try to just do that in the interim during these 5 weeks just to test things, just to try.
Yep.
I'm starting acupuncture. I'm going to lymphatic drainage because with the steroid, I'm so full of fluid. I've gained all the weight I lost back and then some. And we're just kind of diving into natural right now.
Yeah.
I've been given the go-ahead since I'm off trial that I can go back to a lot of the supplements that I used to be on that I wasn't able to take during clinical trial. And who knows, maybe you'll start seeing me come back to life because of what worked for me in the past. I'm able to bring back now.
Yeah.
So we can't say the clinical trial caused this. To be honest, my heart is leaning towards biopsies triggered this. And that it has been a slow movement. And that maybe the immunotherapy kind of set me over the edge a little bit. But I don't want to blame the clinical trial on this.
Well, it's not that you don't want to, it's that you can't because we have no idea.
And we have no idea.
Not a clue. We don't know the biopsy either. That's just like that. Again, that's an anecdotal opinion. There's no indication.
Yeah,
you know?
We don't. So I have zero regrets starting this clinical trial.
Yeah, no regrets.
It still could be my miracle. We don't know.
Could be.
I felt like I had to do this clinical trial. And the timing to lead up to it, like I said at the start, getting in and then opening just on time, in the nick of time, was my sign that this is what the path I needed to go on. And I am at peace with not being on treatment right now. I am at peace with what had happened because it's out of my control. Others give their bodies up in the cancer community because they don't have a lot of options when you live with an incurable type cancer. And somebody gave themselves up to find that sirolimus drug that I was on the first time. There's research paper after research paper that drug truly does help those with EHE. It's now starting to become a protocol.
Yeah, first line of defense.
A first line protocol for EHE because people gave themselves up for this. So I was willing to give myself up for this immunotherapy to try, not only for me and our family, but for future EHE patients that are going to hear this diagnosis. So I have zero regrets. We fly back to Toronto on February the 3rd. I'll still be in my weaning phase of my prednisone, but that is going to be a really big meeting with our oncology team to determine, am I taking pills home with me from that appointment? Because in 2 weeks, I could be going back on trial. Or are we going to continue to pause and talk about next steps of what treatment line we'll look at next?
Yep.
My next CT is scheduled for the first week of March, I believe. And that is going to be a very telling scan.
Yep.
Which every scan is, but that one's going to be really big. So my clinical trial team and meeting with my doctor, that last meeting we had January 5th, I think it was, he found my YouTube page. I'm in his algorithm now.
Yeah.
And he's able to see what I used to be like. Because he's new to me. We're new to each other. We've only ever met virtually before, talked on the phone. When I say that my body could do cool things with stage 4 cancer, words only mean so much. And he can see it. And he mentioned it to us. he saw the difference in my physical presentation, but also the cool things that I could do with my body, because our media team have captured so many races and fitness endeavors that we've done. And it was new information for him. I am not the same person.
Nope.
And he is motivated to
To
get
us
me
back there.
to be that person again.
Yep.
And so if I'm not on this clinical trial, he's not dropping me. He's going to continue to follow me, and we are going to find the next best treatment
Yep, that works
to get
for
me
you.
back to focus on quality of life
Mm-hmm.
and quantity.
Yeah.
I could live to 97. It was the first oncologist that said I had 5 years, likely 3, and we talked about that. And it's all in the way you present the information, your bedside manner, but also giving that hope. But also, we do not know, as I mentioned, this cancer could turn like this. So I just want to get back to setting my body up for success and getting back, because I am no longer thriving. I am no longer surviving. I am simply existing.
Mm.
And that's not fair to me, to you, to our children.
Mm-hmm.
I want to thrive.
You will.
I've thrived before with stage 4 cancer. I know I can do it again.
You will. You will.
So in our last meeting with the oncology team, I asked if I don't go back on this current treatment, do you have anything in mind for me? Because 2025, I had 2 options. Get this clinical trial open and this Votrient drug that's very harsh. He presented that Votrient drug again, but said, like, it could be really hard on your body,
Mm-hmm.
which my body, we always say, like, get your body ready, set yourself up for success. Jumping into a harsh drug when I am just going to be trying to crawl back is probably not a good idea.
Yeah.
And we asked, could I go back on the drug, sirolimus, that I was on for 3 years prior, for 3 years, 1 year prior, that sure became toxic, and I had my mouth sores, my ovarian cysts, my bone pain. I had that cystic acne. Remember, I used to have like those sores underneath my skin. Like, I had a lot of random things. But I feel like I can do it.
Mm-hmm.
I feel like that's my safest choice, because I had so much stability at the start on that drug.
Mm-hmm.
And I never even actually got to therapeutic dosage. So all the research that's coming out from this drug is suggesting you have a trough level in your body. It needs to be between 15 to 20. The highest I got, I think, was like 8 or 9. I'm ready to try to get to the therapeutic level. I want that.
Yep.
I'm motivated, because my first doctor thought, oh, you're stable on it, your shrinkage, with these levels, let's just stay there and stay the course. I want to take that drug and I want to get it to exactly where it needs to be. And I'm ready for the side effects that's going to come.
When you think about it too, like, if you know what the side effects are going to be, you could, like, take it for a period of time and then relax off from it. Take it for a period of time, relax off a bit.
Mm-hmm. He did talk about that. We talked about holding, and he didn't like that idea. You mentioned that.
Yeah.
He said no.
Yeah.
Look at you, going against doctor's orders.
Your whole existence is against a doctor's order.
I actually have videos on mouth sores, on how to help manage them, and meds that did work for me while I was on it. And a lot were natural. There was also some that I took that were medication, and that's a very common side effect, especially with IV chemotherapy. A lot of people get them. I would go days without eating. Some days it was hard to even drink through it. Mm-hmm. But when I think back to that pain, it's not what I'm dealing with now.
Mm-hmm.
I could just get it through. And I would do a tube if I had to,
Mhm.
just to get nutrients into my body during that. I was always stubborn, being like, I'll be fine, I'll be fine, I'll be fine. But if I had to do that as part of my cycle in order to be successful on that drug for it to help my cancer,
Mhm.
bring it on.
Right.
I'm ready. So I think that's where I'm at right now. That's what I would like to do. But who knows? This clinical trial could be my miracle.
Yeah. Let's just continue, like it's a one day at a time kind of thing. There's nothing else you can do.
Yeah. And it's important to remember that this immunotherapy has done positive things for other people. That's why it's moved to a phase 2
Yep.
trial. And the people that are also on it with me right now could be having no side effects,
Mm-hmm.
could be doing amazing. And that's why I do not believe it's solely what's happening to me is the immunotherapy. I believe it came down from the trauma, the potential perforation, all the biopsies, everything that I've been through is a perfect storm
Right.
to where I'm at right now.
Mm-hmm.
Yeah. So March or February, Tuesday, whatever that third is, third or fourth, it's going to be a big one.
Mm-hmm.
So you really stepped up the caregiver role as my caregiver these last few months. We didn't see that coming. We didn't see any of that coming.
It's okay. It's my mission. I'm here to serve. That's my job in life. It's to serve.
Yeah.
Not easy. Frustrating at times, but that's my job. I'm here.
Yeah.
You want to leave it there?
I think we'll wrap that up from here.
Cool.
And hope that in a week's time, if I'm not better, I'm going to get that HIDA scan at some point.
You're pretty determined.
I am.
I'd say it's in your future.
Or I'm magically fixed. I would love that. Obviously, I would love this new medication regime. I'm going to be better every day because as we were getting ready to film, I felt a growl in my body and I haven't felt a growl in a while. So that is
it's positive.
Even though I have radiating pain through my back right now as I'm sitting here, I felt a growl and a growl is exciting.
Very.
Anyways, thank you all so much for your love and support through all this. It's been a time.